Hello. I had a chance to be at the Jersey Shore this weekend in my favorite time of year, the shoulder season. September was just beautiful, and I hope you too had a chance to enjoy the weekend. So much great news this last week at the end of the week, and I know it's been confusing. I heard lots of people asking questions. The booster shot is now available, and the most important thing is to understand if you fall in one of these categories, please take the time to come get your booster. We have the walk-up available at both Mullica Hill and Vineland. You can see the hours posted above. We will continue to adjust that based upon demand. It is so important that we do everything that we can to slow the spread of this virus. I wanted to share a story about one of our employees' insights in reference to the COVID vaccine. And you know, Heather Lindstrom works in our patient experience department, and she's always out there cheerleading for the rest of us, making sure that we're doing the best that we can every single day and giving us constant feedback on how to do that better, sharing your comments with us as we get them real time from social media. And Heather said for her, getting the booster really was about the science, and it was about the science of all of the vaccines that have come before. And today, we don't think about those things. You don't think about a smallpox outbreak or pertussis or that tetanus would cause paralysis. You just get the vaccine. And I think that's Heather's message to all of us, is I know this must seem like a scary time to some, but think about all the things we've overcome through time and how for many of us who have at-risk parents and family members, making sure that we've done everything we can to protect them. Yes, you have choices about yourself, but this isn't about impacting the broader community and your loved ones. And we need to think about that as this virus continues to spread and mutate, and that we continue to struggle with what are some really scary statistics. In New Jersey, we are on the verge of 25,000 dying from COVID. 1 million people impacted. That's 1 in 9 people who now have had COVID. The vaccines, the boosters, all of that. In addition to wearing your mask, washing your hands, and remaining socially distanced, are the tools that we have available to us today. And we need to use them. Speaking of using our tools, October's flu shots. And the flu season is upon us. And so I would really encourage you to make sure, especially during this time of this COVID virus spread, that is available widely, including at our own sites. And so we'd welcome you to make sure that you take advantage of that. September recognizes Peripheral Artery Disease Month, really understanding how to partner with your vascular surgeons when that procedure is necessary to make sure your heart can work as well as it possibly can. In addition, September 29th is World Heart Day, really taking the moment in time to acknowledge all of the success we've made in the heart research, but also understanding it still remains the #1 killer in the entire world. And those symptoms are often silent, often things that we ignore. Oh, we worked out too hard. Oh, it's just a little indigestion. Please make sure you pay attention to those things. When your body talks to you, it's telling you. And so being able to go to your urgent care or see your primary care physician really makes sure that you know what's going on and be able to care for yourself as you can. In addition, I want to share with you some of the great work we're doing in October for Breast Cancer Awareness Month. You'll see that we have some sites open where you can either make a bouquet or write a card to a patient. As patients are walking that journey, being able to have the full support of the community and just a quick little card, I can't tell you what a difference that makes in people's journey, and also just knowing that they're not alone in that. So as we say every week, we thank you for the ability to care for you, for the partnership that we have with you, and the tremendous honor that our staff are able to be with you and walk this journey, especially in this time of great confusion around COVID. Please come to us as a trusted advisor. I know that we will continue to provide updated information as soon as we get it to you so we can answer your questions. Until we meet again, be well and stay safe.